The agenda this week took stock of the federal government's fiscal update, surveyed Ontario's manufacturing sector, and got the latest on research into treatments for HIV. The agenda's week in review begins with the well-being of seniors during this COVID-19 crisis.
What I've really been seeing and I've been thinking about is what I might describe as kind of the psychological and also the psychiatric. I think the psychological impact is interesting because there's so many people who are kind of 70 something and above who didn't really think of themselves as frail and vulnerable. And I think we all realize so much of the messaging initially around from public health officials, which was so important around guidance and safety. It really highlighted to so many people that they were in this kind of group that needed to be so fearful, so afraid. And so what I've seen is this sort of psychological experience of older adults who might have seen themselves, as Christina described, as really vital, really, kind of active, who then needed to think of themselves as the most vulnerable and really kind of impacted their self-concept in a way that has been, really sad as we, and as Dr. Stahl and I both work together, we spend so much of our work trying to empower older adults and help them to feel, vibrant and as active as they can. And it's nobody's fault. It's just the effect of some of the direction, especially in the early days. And so I've seen this sort of psychological, almost like involution, this kind of withdrawal that's happened for older adults around their, self-esteem, their sense of mortality, their sense of trying to balance like their physical health and their mental health. And I think so much of the messaging really privileged, understandably, their physical health in a way that made people feel really small and really fearful. And then I think on the psychiatric side, what I've seen, is that it's really, really hard for people who are getting more mentally unwell to access care. As many of us have talked about, one of the great things about psychiatry is you can do it virtually, like the way we're doing this conversation, but you can only do virtual care with people who can do virtual care with you. And so many older adults are marginalized, they can't access, kind of technology. And that's not meant to say that there aren't older adults who are very savvy. There are, but there are lots of people who were marginalized before this who can't access social supports, let alone psychiatric support. So it's like a double hit in terms of their well-being.
Christina, we pointed out earlier that you wrote about this for Maclean's a couple of weeks ago, and I want to read an excerpt from that article just to set up our next point of discussion. From the beginning, you wrote, there's been one constant with COVID. There's never a painless option. Living with the virus always involves some kind of taboo trade-off, staying home or going into work, hugging grandchildren or keeping a virus at bay, allowing spouses to visit or shutting the doors of long-term care to anyone who might bring in an illness. But somewhere in those trade-offs, individuals have the right to make choices about their lives. Well, this really gets to the nub of a very complicated issue, which obviously decision makers are dealing with and families are dealing with, and that is, partly is the cure for COVID worse than the disease itself, and have decision makers taken the ability of families to make their own decisions out of their hands in the interest of broader public interest? Why don't we get into some of that? Christina, what can you tell us on those two scores?
I think we're failing our older adults when we talk about this in really black and white terms, that the only options are isolation or not. And that's simply not the case. We have a lot of things we can do as families and as communities to help out older Canadians and to support them. And so one of the things that Dr. Samir Sinha had said to me is that this is a conversation we don't get to make for our grandparents or our parents. This is a decision we make with them. And we sit and talk to them about what is important. Think of it, what I found really helpful was to say, think of this as a kind of advanced care planning. Like we often think of advanced care planning as something you do for the very end of life, about what I would do for someone I love if they could no longer speak for themselves. But we're talking about a quality of life issue here. And so sit down and talk to people about what really matters to them. Is it most important to my parents that they have visits from their kids and their grandparents? And if so, how can we as a family have that conversation about how to do that as safely as possible for them? And maybe it means that I don't go out and spend my nights in restaurants or in pubs or whatever else. But my most important priority in my life is making sure that I get to see my parents and do that in a way that's safe for them.
Money's just dirt cheap right now for the government of Canada to borrow. And if you need to stimulate the economy and if you need to protect people from the worst ravages economically since the Great Depression, you can't do it much better than when you're borrowing money at 1%. In which case, isn't this the time to go deeply into debt if you have to go deeply into debt?
Well, there's that if you have to go deeply into debt right now. I totally agree that the economy is going to need some help. I think that the fact that so much of that money, remember the 7 going out the door for the every dollar, a lot of that money is being banked, and there's a reason a lot of people who have banked it can't spend it. They can't travel, they can't do the things they want to do. So it's very possible, as Kevin said, that we may not need some of that stimulus, and that's why I love the idea of guardrails. I just like to know what they are. And I'm hoping that we will get that in the spring. And my fear is the reason that they haven't told us what they are is that they're going to set them up in such a way that it will justify whatever stimulus they want to spend. And the reason I think that is they've already announced they intend to stimulate without even knowing, on what basis or when they want to do it. And I find that very curious. Usually you shape a policy around saying, we want to do this, and then we find the money to do it. You don't say, we're going to spend X, and then we're going to find things to spend it on. So to your question about the price of debt, look, obviously it's better interest rates are low. It's the only reason we're not in a crisis already. But I think just assuming that they're going to stay low forever, and remember, a lot of the debt we're taking on is not long-term. A lot of it is 5-year bonds, not 30-year. They're changing that now. But it's a bit like saying I went to the casino and I had a really lucky night, so I'm just going to assume that every night is going to go the same way it did last night.
Gotcha. Well, let's talk about one of the real big-ticket items that came out of yesterday. And the commitment to spend billions and billions isn't quite there yet. It's still in the let's see what we can do phase. Here's Chrystia Freeland on child care. Sheldon, roll it if you would.
I say this both as a working mother and as a finance minister. Canada will not be truly competitive until all Canadian women have access to the affordable child care we need to support our participation in our country's workforce.
Kevin Page, everybody's saying this. Everybody is saying that if there's anything good going to come out of this COVID-19 pandemic, it's that finally governments are going to get serious about putting a national child care program in place. However, the fine print always says child care is a provincial responsibility. We've tried going down this road so many times in the past and haven't quite got there. What makes anybody think this time is going to be different? Let's start off with you, Kevin, on this one.
Again, you're asking really tough questions, Steve. So this is, I would say on this, that I think there's a sense, in the context of COVID-19 that there's a possibility of doing, people use the word social resets or strategic resets. And then, where you start to realize that, what has happened to us and, the impacts that Angela's talked about in big parts of the labor force. So, going forward, is there an opportunity to change? And with respect to the federal provincial aspects to the child care discussion, I think the government is going to be very careful. Really, all they talked about in terms of funding this is to study it. Really tens of millions of dollars to study how could possibly we bring this about. But if we're really talking about a big program and it's going to need tens of billions of dollars across the country in order to create a Quebec-style program, then we're just going to have to be honest that we're going to have to raise taxes. And again, I think that's the conversation for childcare, but I think there's going to be other programs, basic income programs, potentially even some climate change type of infrastructure programs. Taxes probably will going to have to go up over the medium term as we get through the crisis.
Angela, I know Rome wasn't built in a day, but I suspect there are some people who were hoping that they'd see more than just the promise to create a secretariat to look into how to doing this. Were you disappointed with this part of the announcement?
Absolutely. All of the narratives leading up to the speech and the speech itself indicated that the government was ready to take this seriously. We have in Ontario, about a third of childcare centers have closed because of the increased expenses of delivering care in a pandemic. And mothers are talking about just staying home instead of going back to work. And so, especially if you have children under 6, there is action they could have taken to support existing childcare centers in staying open to deliver care right now, the way that they're delivering $1 billion to long-term care homes. So I was hoping to see something like that. I was glad to see some money around training. That's a lesson learned from Quebec and how Quebec implemented that they didn't have enough skilled workers. And so to get started on the training, I think is a good plan. But there's definitely going to be a lot of skepticism because this has been promised several times in my lifetime and it hasn't come to fruition. And I just want to say this is not a social reset. This is an economic reset. If we had childcare for all children, it would contribute $1 billion to the economy, which is as much as the stimulus that the federal government is.
After World War I, Canada really was a global powerhouse. And that's in part because we were part of the British trading network. And that gave us preferential access over the Americans to the markets in Britain, Australia, New Zealand, South Africa. And so actually, we were the ones making their cars, not Detroit. They were coming out of Windsor and out of Oshawa. And that made us the second largest producer of cars in the world. And that gave us the foundation where skills were developed, the infrastructure was developed for a manufacturing sector. Of course, we lost a lot of that after World War II as other places started producing their own cars. And by the 60s, we needed the auto pack to even survive because we had a large number of plants that just weren't producing enough. And so the numbers you showed there, starting in the mid-70s, are a reflection of the auto pack. And the auto pack really did give a boost to manufacturing, particularly in Ontario, particularly in cities like my own, where I worked in Windsor, and the plant I worked at Ford Motor Company, where I made engines, which is very much an auto pack plant. What has happened since is we have just lost sector after sector after sector. And if you think about Hamilton, where I live right now, we used to make elevators, we used to make Levi's, we used to make appliances, we made shoes, we used to make glass bottles, textiles, and whatnot. It's all gone. And now the plant here in Hamilton, where we used to make appliances, it's a green field. Somebody cuts the grass, but that's the limit of the employment.
Well, let me ask you the bottom line question then. You clearly described a situation where manufacturing was the backbone of the provincial economy. Is it still?
No, absolutely not. I mean, the numbers you showed right there indicated less than 10% of our GDP comes from manufacturing. If you think about this in human terms, back in 1976, when about 4 million people were working in Ontario, almost 1 million of those were working in manufacturing. Today, about 8 million people are working in Ontario, but less than 800,000 of those are in manufacturing. And so people just don't look to manufacturing for a career. They're looking at other places in the economy for a life.
Well, I have a feeling that the woman who employs 26,000 people in 60 plants in 17 countries around the world may want to take issue with some of that. So, Linda Hassenfratz, tell us, for those who say manufacturing's on its last legs, you say what?
Well, I couldn't disagree more with everything you've just heard. In fact, when I look at our own organization, we have grown dramatically over that exact same time frame. We've even grown dramatically over the last decade. I mean, if I look at our Canadian operations, because if we're going to, focusing just on Canada, our sales in Canada grew 76% over the last 7 years between 2012 and 2019. Our productivity increased 60%. Our workforce grew by 40%. Now, admittedly, the jobs are changing. We're doing more and more automation on the shop floor. So we tend to classify our folks into two categories: direct employees, who are people loading and unloading machines, and indirect is everybody else. I'm an indirect worker. So are folks in logistics or administration or maintenance, etc. So our numbers have changed a lot. So as I mentioned, since 2012, our overall workforce in Canada by 40%, but we've increased our indirect workforce by almost 70%. Our direct workforce has grown as well, but only about 20%. So you can see that the face of manufacturing is certainly changing. And to me, in my opinion, there's never been a more exciting time to be in the manufacturing sector. And I would strongly encourage people to indeed look to the manufacturing sector as a place to build a career, because there are a lot of exciting things going on, a lot of exciting jobs to be had, and we're doing a lot of important things in terms of coming up with solutions for some of the world's biggest problems, whether it be climate change or bringing, clean water or food to a growing global population. Manufacturing is who's coming up with those solutions. So if you want to be part of that, you should join our industry.
So today we still have the same broad principle, which is that most of the time we are combining medications together, 3, sometimes 2, but usually 3 medications together. But those things now have much less in the way of side effects as medications, and they can be co-formulated together and taken just once a day. So most of the time when I have a new patient in the clinic, I'm able to start that person on 1 pill a day and maintain that person with just that 1 pill a day for the rest of their lives, which will be a fairly normal lifespan, and which will be, I think, very different to the life that would have been lived by somebody living with HIV 20 or 30 years ago, in the sense that people have, there's even some very interesting model that suggests that if I'm diagnosed with HIV today and start on medications, my life expectancy may be increased. I don't know that I completely believe this, but maybe increased above that of me without HIV, because not only do I have excellent medication, which is able to suppress the virus very well, but I'm going to be seeing the doctor more often, so perhaps I get other health care that has health benefits and is able to prolong my life as well. I don't know that life will be longer, but I certainly think that life expectancy will be almost the same, and there's much less in the way of stigma in the sense of the transmission to my unborn child is going to be minimized with the current regimen. Transmission to my partner is really prevented completely with current treatment. So that same treatment, if I am able to bring down the virus level to undetectable, that is going to prevent transmission to my partner, to the point that Justice Canada announced a few years ago that they no longer recommend prosecuting cases where patients do not, where a person living with HIV on treatment does not disclose their HIV status to their partner, because there is no realistic chance of transmission.
Well, let me follow up with you on this, because we talked again in the timeline at the beginning about PrEP, which is a preventative form of medication and treatment. How exactly does that work?
So PrEP is a simplified version of the same regimens that we use for treatment. So generally the treatment that we give will be 3 medications. PrEP is often 2 medications given together in one tablet called Truvada, was the original PrEP. And essentially, usually we give PrEP continuously. So every day I take one of those pills every day. And if I'm able to do that, that reduces my risk of acquiring HIV if I'm exposed, not to 0, but 95% plus reduction in my risk of acquiring HIV. And actually coming down the pipeline, probably in a few years, will be even better regimens. There's some very nice data coming out at the latest World AIDS Conference that an injectable medication given just once every couple of months is even more effective than that daily pill. So I think that the way that we prevent and treat HIV, we have injectable treatments coming as well, is going to change quite a bit over the next few years.
It looks like we're going to have a vaccine to COVID-19, potentially within a year of its arriving on the scene. And 40 years later, you still don't have one for HIV or AIDS. And I guess I need to know how annoying that is for you.
Well, so, I'm sure everybody's heard Dr. Fauci on television, because he's also an HIV vaccine researcher, and you hear for 9 months, most of us who've been in the area of HIV vaccine and following that progress very closely, we're very worried about how likely is it that a new virus, could be dealt with in a form of a potent vaccine, and at best, and even WHO, for COVID-19 said if it's 50% efficacious, we'll take it. Considering the level of death that's occurring around the planet. So I'm delighted. I always say to people that if it were a pandemic flu, which we were quite prepared for, in fact, H1N1 we dealt with, very very well, because flu vaccines, we know exactly how to make them. And it was made, and within months, we got rid of H1N1. This was a new virus that we didn't know anything about. Given the possibility that it's an RNA virus, it could have gone the way of HIV, which is also an RNA virus, and very difficult to formulate a vaccine against. But fortunately, we have gone the way of the flu rather than the HIV vaccine. So I'm happy that at least we won't be living in a pandemic for years and years. But on the other hand, there are lessons to be learned. I have to say that the COVID vaccine, one of the reasons for its success is how much more we understand about vaccines based on HIV vaccine and its failures in last 30 years. So a lot of those lessons were carried into the COVID-19 vaccines, but now we can flip it around and see how much we can learn from COVID-19 vaccines to take the field of HIV vaccine forward.
That's just some of what we covered this week on The Agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.